bright. Turn it a bit. So, people join on Instagram. Nice to see you. I have been away for a couple of weeks, so it's lovely to be back. Wow, how lucky with the weather. Although actually, I don't think it was luck. I do think, that there is a thing, with all this manifestation and stuff. Having said that, I didn't really manifest it, though. I didn't really manifest the weather, but anyway, very, very nice weather while we were away, and now we're back into it. And I've got to be honest, didn't really do anything for the holiday, but feel like I need another holiday. But there you go. That's it. Enough of my problems. I'm going to now talk about your problems. So if you've got any questions in the plastic surgery arena, feel free to post them on the Instagram, on the Facebook, on the YouTube, because we are on YouTube as well. Let's not forget that I am a YouTuber. So feel free to ask away. If you haven't got any questions, that's also fine, because I have got questions of my own. So Instagram has said something. Oh God, I've got to get in there quick before it goes. Is it possible to feel your stitches pulling post tummy tuck fleur-de-lis? And is it something you should be concerned about? Oh my God, Facebook as well. Is it possible to feel stitches pulling? Yeah, Rosalina, it's not so much the stitches that you can feel pulling, although it might be the stitches that you can feel pulling, but you can also feel what the stitches are attached to, if that makes sense. So when we do a tummy tuck, the deeper layers of the tummy tuck have got stitches which are attached to what we call fascia, which is, well, it's just a white layer of tissue deep underneath the skin, and it really holds the stitches well. So that pulling on that fascia, you might feel that tension underneath the skin. So that's normal, and it is nothing to be concerned about. Although if you are feeling it pulling, I'm guessing you're doing stuff. So maybe take it easy is what I would say to you. But yeah, the fact that you can feel a bit of pulling in your stitches, whether that be centrally with the rectus muscle repair or whether it be down the lower part, then that's in itself not a problem. But do take it easy. Danny, you're always discussing the most random things when I tune in. Thank you for that. Take that as a compliment. Charlotte on Facebook. Hello, so nice to be here joining you again. You may not remember me. I joined your Q&A just over a month ago, and you answered so many of my questions. I have more. Charlotte, ask away, because I've got to be honest with you, Charlotte, you've got competition here, because Miss Karina Bean has asked a question over there as well. Also, thank you so much for taking time out of your own personal time to do this for us. It's such a great guy. Yeah, well, that's very kind of you, Charlotte. And Khan, long time no see. Khan, how are you doing? Lovely to see you here this evening. Miss Karina Bean is saying, hey there, I've bottomed out implant confirmed by 2 surgeons who noted the scar was high on examination. However, 6 months on, the scar is now in the IMF, inframammary fold. Isn't that very strange? Bottom out implant who noted the scar was high. 6 months on, the scar is now in the IMF. So what you're saying is your implant has gone up. Miss Karina Bean, your implant was bottomed out and it has gone up. Is that what you're saying? Because if your implant's bottomed out, your scar, this is implant, just to be clear. Okay, we'll just use hands, shall we? Have I got any implants? Anyway, this is scar, this is implant. So your implant's bottomed out, so your scar looks high. You're saying now your scar is in the inframammary fold, so the implant has gone up. Isn't that strange? Yeah, that is strange, Miss Karina Bean. I think if anything, the implants often start high and settle in a downward direction. So that's commonly the way it goes. It usually goes down. So I would be a bit concerned if your implant was low and bottomed out, that it might not improve, but it has. But what this tells us, Miss Karina Bean, is that you've got to leave things to settle, because things do settle. And I think patients often don't believe you when you say that, or at least they think, oh God, it's gonna, he's just trying to palm me off and stuff. But you have got to give things time, and that's great news that yours has, by the sound of it, sorted itself out. I hope I'm reading that right. Danny, we discussed me getting a tummy tuck. I have a large tattoo on my ribs and wondered how this will be affected. Do I need to send a picture? Hashtag Ask JJ. Well done on using a hashtag, Danny. That's an early hashtag Ask JJ in there. What is it? 7:09. So 9 minutes in, and we've got a hashtag Ask JJ. You can send a picture, Danny, on your ribs. It's not going to be affected, I don't think, Danny. To be fair, I don't think it's going to be affected if you have a tummy tuck. If it is on your ribs, the tummy tuck removes the tissue from your belly button down to your top of the pubic hair. So your lower abdomen, that's where it removes tissue from. It doesn't remove anything, any skin above, or at least not much skin above the belly button. So any skin higher than that, so obviously your ribs are higher than that, will not be affected. It might get pulled down a bit. So if you notice a bit of your tattoos on your lower rib, it might get pulled down a bit. But I don't think it would affect it significantly, Danny. But you're more than welcome to send a photo. info@staianoplasticsurgery.co.uk. I'd be happy to have a look at it and get back to you on that if you would like. I second Charlotte's comments. Thank you, Miss Greenerbean. That's very kind to you and Charlotte. Rosalina, is it okay to wait a few days longer to change FDL and breast lift tapes dressings? Was recommended to change every week, but needed to wait 10 days instead for some assistance. Now, Rosalina, I know for a fact I haven't done a fleur-de-lis tummy tuck for a while, so I don't think you're my patient. So I think you should talk to your surgeon, because I don't want to be telling you what to do with your dressings if you're someone else's patient, because I wouldn't really want one of my patients asking another surgeon what to do with their dressings, because, we all have our own regimes on it. So I would talk to your surgeon or your surgeon's nurse, or someone about that, about when you should be doing that the dressings and what have you, because we all have our own regimes. Miss, is that rain? Oh, I think it's a food mixer. Okay. No, it's the vacuum cleaner, isn't it? Okay, sorry. Miss Karina Bean, it still is bottomed out when my arms are raised, but it's not so obvious now when I'm standing normally. Well, that's really important, Miss Karina Bean, because you want it to look normal when you're standing normally, because a lot of times people will say, look at my implants, they look wrong when I'm getting that position. And I'm like, well, if they look fine when you're in a normal standing up position, if I fix the problem that way look weird when you're in a say an arms raised position. So if I make them look normal when you're in an arms raised position, they may not look normal when you're in an arms down position. And it's more important to have them look normal when they're at rest. Often when you get in funny positions, your body in general can look abnormal. Your tummy and your things can look abnormal when you're in. So that's good news, Miss Karina Bean. I would be saying that I'd be happy with that. Frankie Face, is it safe to lose weight after an areola reduction, or will it affect the nipple? I think it's always safe to lose weight, Frankie Face, and that will be absolutely fine. I mean, it's marginal what happens to the size and the shape of your areola when you lose weight. Well, first of all, it's not so much losing weight; it's losing volume in the breast. So come on, what's the word? Not always the case. Not always. It's unpredictable. Yeah, unpredictable what happens to the size of your breasts when you lose weight. So sometimes you lose weight and then nothing happens to the size of the breasts. Sometimes they get smaller. So that's the first thing. And then if they did get smaller, the areola might shrink a little bit. Similarly, when they get bigger, the areola might get a bit bigger. But it's going to be marginal, the effect of the areola, bottom line. So carry on and lose weight. We got can I just please point out, viewers, we've got a comment on YouTube. So Amee Jade, I'd like you to confirm for the viewers that I am clearly a YouTuber, because Amee Jade is watching me on YouTube. Not only watching, commenting. Look at that. Thank you, Amee. I mean, you is the comment. I'll take that. I mean, that's a good comment. So thank you. Comments on YouTube are coming in thick and fast. Oh my God, she's getting two. I've got another one. Amy's got another one. I'm late. How was your holiday? Holiday was Hey, Amy. Holiday was great. Weather was fantastic. And, you know, in this country, when you get good weather, can't beat it. You know, Costa del Cornwall, awesome weather, beautiful beach, you know, surfing with those little surfboard things, you know, not I thought I had a wetsuit, but I'll be honest, full disclosure, I couldn't close it. Couldn't close it. I'm sure I have used it in the past. So but mind you, I was brought up on the beach, and back in the day, our hotel in Cornwall was on the beach when I was brought up. And then when only wetsuits were only for pro surfers. Now it seems like everybody and his uncle's got a wetsuit. So I went in with t-shirt and shorts. It's fine. But yeah, really nice, really nice break. Thank you, Amy, for asking. What's going on here, Rosalina? How long after a breast lift can you tell what size your boobs are going to settle at? Hashtag Ask JJ. Hashtag jumping in on the bandwagon. Big fan of hashtag several words together that are never ever going to be used again. And when you actually type it in, it says one other post with this on it. So I would say first thing, Rosalina, after a breast lift, the size of your breasts, broadly speaking, should be the same as it was pre-op. So your size of your breast doesn't change significantly after a breast lift. In fact, I've done one about 5 hours ago or so, and you do remove some skin when you do a breast lift, but we weighed it, and I think it was 18 grams on one side and 20 grams on the other side. So it's a very small volume that is removed when you do a breast lift. So broadly speaking, Rosalina, your volume, your size of breast, your cup size should not change. Your cup size should be the same post-op as it was pre-op. But you're absolutely right to say things settle, and yes, they take about 3 months for them to settle, but it's mainly the shape that settles rather than the size. There will obviously be swelling and things, but I wouldn't have thought you need to go and buy particularly any new bras or things like that. You should be able to wear the same bras you were wearing before, but the difference is when you take the bra off, the breasts don't settle. They sort of stay where they are. Good God. What has happened on Facebook? I've just seen a comment come in on Facebook. Quite frankly, I think that is the award for the longest comment. Wow. What's happened? Oh, look, YouTube now. Amy has single-handedly 1, 2, 3, 4 comments on YouTube. Thank you, Amy. Cornwall is Butte. You should have stitched it up, Amy. It would have broken. I couldn't. No one could have stitched that wetsuit up. I was that. It wasn't going to happen. I've got to face Charlotte's message at some point on Facebook. I'm going to put it off. I'll do Charlotte. I'm just going to do the Instagram ones, but I will. Oh God, thank you. I'm going to put. I wondered if it would be stretched down and distorted. Now that's Danny. Is that the weight loss after an areola reduction question? Let me just check. Oh no, it was a tattoo. Yeah, it will be. It might be a little bit, but Danny, but not a huge amount, because the skin and the ribs is a bit more set. The movement comes from the skin from the belly button to the rib cage. The rib cage skin doesn't significantly move. So if they're on the rib, if your tattoo's on the ribs, I don't think it'll significantly distort. I don't think. If it was on the upper abdomen, it might get a little bit distorted, but I wouldn't have thought it would be terrible, even if it was on the upper abdomen. But certainly on the ribs, my gut feeling is that it wouldn't be affected much, Danny. Frankie Face, not a lot of weight. I'm talking like one dress size. Now, Frankie Face, were you the areola reduction? Yes. Yeah, in that case, go for it, Frankie Face. Don't worry about the areola reduction. You'll be fine. Jackie Crimes. Miss Karina Bean, can implants placed over the muscle cause the natural breast to sag quicker than if it was placed behind the muscle? No. If you're people people often say, can this nuance thing, like, oh, I'm thinking, crikey, could it? Maybe it could. I don't know. There are some big things that have an effect. So people arguing, theoretically, could this have an effect? I'm like, well, maybe, I don't know, implants under the muscle get squashed a bit. So should I have a bigger one? I'm like, well, maybe, but not really, basically. So there are some big things that cause your breast to sag, Miss Karina Bean, and that is weight loss and having children. Those are the big ones. Having the breast implants over the muscle is not going to make your breasts sag quicker. The difference is that when they're under the muscle, sometimes the muscle can hold them up. So the breast can fall off the implants, and you have an implant sitting high and a breast sitting low, because you really want your implant to sit with the breast. So particularly if you have got, so that's why patients, I might be going off piste here, but bear with me. That's why patients who do have a bit of a sag can be a challenge, because you want the implant to sit with the breast. So everything else being equal, I would probably be more inclined to put them on top of the muscle if you've got a little bit of a sag, assuming you don't need a lift. Obviously, if you need a lift, then that's a different thing. But assuming you don't need a lift, I try and put them on top of the muscle to make the implants sit lower, to sit with the breast, because I don't want the implants being held high by the muscle. And that's where the challenging case comes of someone who's very slim. You can see their rib cage and their breasts are sitting low. So that's a challenging case, because you want to put the implants on top of the muscle because the breasts are sitting low, but you're worried you're going to get rippling with CVHs. So that's why you think, I've got to put them under the muscle. And that's where this dual plane, particularly the dual plane 3, comes in. A lot of people talk about dual plane. There are different types of dual plane. And the dual plane 3 is when breasts are sitting a bit low. So you actually do make 2 proper planes, one on top of the muscle, one underneath the muscle, to release the breast off the muscle to let it sit with the implant. And that is probably the most difficult type of breast augmentation you can do, a dual plane type 3, for someone who's got a bit of sag but not much breast tissue. But in answer, that's not really answering your question, is it, Ms. Karina Bean? No, the natural breast is not going to sag quicker if the implants are placed beneath the muscle. Rosalina, is it safe to lose weight, stroke gain weight, half a stone each way after a tummy tuck? My weight goes up and down a bit naturally. Is it safe? I mean, you can do, Rosalina. We all got to live a life, but it's not ideal, because it's going to stretch the skin. But if it's a small amount, it's not going to stretch the skin that much. So yeah, it's not ideal, but you got to live. So if you ask me, I'd say don't do it, but you might say, well, I've done it already, or I can't help it. I keep on, my weight fluctuates. I'm like, well, that's what it is. I can't put it off any longer. I'm going to have to do Charlotte Turner. Let's do it. Let's do it, team. Right. I'm going to show it on the screen, but it's not going to do it justice. Right. Sit back, guys, because I will count. I don't know if I think there are questions on Instagram, but I will ask them. Right. Firstly, I am 4 weeks post-surgery, breast implant replacement / breast lift. Let me get this right. Breast implant replacement / I got it. I travel abroad to Prague to have a surgery. Second time I've done it, used the same surgeon. However, this time around his aftercare has been shocking. However, this time around his aftercare has been shocking, and he hasn't answered any of my aftercare questions, completely blanking me. And as he is abroad, it is a bit worrying. A few hours after the surgery, I fainted and landed very hard on my right breast. I caused a huge bleed, needed to be taken back into theatre to stop the bleed. Also had 4 blood transfusions in this process. Anyway, 4 weeks post-op, my left breast is looking great. However, my right breast is still very swollen and does not look round like the left one. It almost looks square on the bottom. I'm getting paranoid that I have damaged the implant breast tissue. Are implants quite resistant to trauma? Is it wrong that I demand him to see me at 3 months to check this? Do you see your own patients at a certain post-operative date? As soon as I am back in the UK, that is basically it. Lol, I don't get seen again. Do you maybe recommend I get a plastic surgeon in the UK to check, seeing as mine can't be bothered? Right, not too bad actually, Charlotte. It looked worse than it was, but it's not too bad. Right then, Charlotte. So sorry you've had a bad experience. And it sounds like you've had a rough time of it. And so the question is, are they resistant to trauma? Yes, they are resistant to trauma, Charlotte. And I normally say to people that if you did damage the implant, you'd probably do quite a bit of damage to your body in the process. So a simple fall, it's not a simple fall because you've had a bleed and for blood transfusion, which sounds pretty excessive, but a fall is unlikely to damage the implant, I would say, and it's not unusual for it to still be swollen at 4 weeks. So that's that bit. Is it wrong to demand? Like, he's seen me at 3 months to check this. I mean, it's a bit harsh. You have to demand it. I mean, I think it is normal process to see patients. So do you see your own patients at a certain post-operative date? Yes, I do, Charlotte. I see patients. Well, normally the 1 week appointment is done with Vicky, the clinic nurse. If I'm around, I'll pop in and say hello. And then we have a normal sort of regime, if you like. And then if people have a problem, we'll see them at any time. That's the way that we work it at my clinic. So I normally see people at 6 weeks, then 3 months, then 6 months, then 12 months, then yearly. That's the normal regime that I will see people. But if they have a problem, I will see them any time. So if you have a problem at 4 weeks, or whatever. But I think this is one of the issues with the huge variation in particularly in price and in the quality of the care that you're given in this industry. There is quite a wide variation, so it is very difficult for people, and unfortunately you often only realize it post-op, like you are, although you, as you say, you had a previous op and it was fine, which is unfortunate. And then you say, do you maybe recommend I get a plastic surgeon in the UK to check, seeing as mine can't be bothered? This is another problem, Charlotte, because I think you might struggle to do that, because I think most plastic surgeons don't, well, I don't want to speak about others, but certainly for me, I don't really offer an aftercare service on its own. So if people have surgery with someone else and then want me to take on their aftercare, I don't offer that, because the way it works is that you pay for the operation and the aftercare is part of that, is included in part of that. There's not a separate price for the aftercare. So you can't get sort of a cheaper operation elsewhere and then just pay for an aftercare package here. If you have a surgery somewhere, they're responsible for your aftercare. So you would struggle probably, I would imagine, to get someone to see you. And it really, the onus is on your surgeon and your whoever, you did your surgery to look after you. But 4 weeks is early days, Charlotte, so maybe things will settle. I live in Cornwall. Charlotte's in Cornwall. I'm going to put her off. Charming lol. Charlotte, go and see James McDermott. He's local to you. Yeah, James McDermott is down that way, isn't he? Crinkly Bottom. What's he called? McDermott Hall. Yeah, that's a lovely. Well, I've seen pictures of it. Lovely sort of estate place he's got down there. So you could try, Charlotte. I don't know if he would see you. He might. You never know. But he's certainly a very good, very well-respected plastic surgeon down your way. So, yeah, that's a good comment there from Sharon. How much is a neck and lower facelift, please? I don't know, Rebecca. I don't do it. I don't do that sort of stuff, Rebecca. I don't do necks, faces, Botox, fillers. I just do breast and body. So I don't do, I don't know, maybe someone else has had one. Maybe they know on this forum. Sorry, I don't know how much a neck and lower facelift is. Charlotte, that is fair enough. You can see why it's expensive in the UK, but I think I would have rather paid UK prices just to get good aftercare. You sound great with how often you see your patients. Thanks so much for replying. Yeah, you're welcome, Charlotte, and good luck. And hopefully everything will settle and be okay. Thank you. Well, thanks for asking the question, Rebecca. I'm sorry I couldn't be more helpful. What's happened over here? Miss Karina B, especially if the breast is slightly ptotic to start with, have unders but want them over, but worried it will make the ptosis worse. Hold on a minute. What was the original part of the question? I've lost it now. Not so. I need an assistant. Don't I? I think I can't be expected to do this on my own, honestly, man of my caliber, really. Oh, that was can implants placed over the muscle cause the breast to... Okay, got it. I'm on track now. Especially if the breast is slightly ptotic to start with. So ptotic means droopy, viewers. Okay, so have unders, but want them over, but why would it make the ptosis worse? No, it won't make the ptosis worse. If anything, if particularly Karina Bean, if your implant is sitting high. So if your implant is sitting a bit high because they're under the muscle, which it can do, it's not all, they're not always sit high when they're under muscle, but it's just a risk. So sometimes if the implant is sitting high and your breast is sitting low, it's not great. So one of the ways to cure that is to put them from an under to over plane. The only thing that would worry me is that obviously someone has thought of putting them under the muscle at some point because you have them under. So they must have been worried about the amount of soft tissue cover you've got. They must have worried that you might be at risk of rippling, etc. So that would worry me. I think is if someone has made the decision to put them under at some point, there's obviously a reason for that. Now you might be suffering a complication of it in that they might be sitting high, but are you risking that complication happening if you then go and put them on over? Yeah. Oh, excuse me. Glass of water. Sorry. Really interesting. Thanks, JJ. You're welcome, Miss Karina Bean. And Rosalina says thank you. I wish I could like you. I can't like you. Can I like you on? Oh God, I can report you, and I can go live with you. That's all I can do on Instagram. Oh God, why are you reporting? Oh God, I've just reported you. Sorry, I don't want to report you. Hold on a minute. I'll report. I don't want to report. I don't think I reported you. Sorry. Thank you anyway. Amy J, not a question, but still using Ask JJ, loving it. But can't wait to get my weight down and maintain so I can book in art. That is the spirit, Amy Jade. Get your weight down, get it maintained. That's the way you get your best result. So I've got a question here, preordained. First of them. That's pretty good, isn't it? I mean, night 7:30, 30 minutes of organic questions. I mean, you've got to be happy with that. I'm happy with that. By the way, keep the organic questions coming, especially Charlotte. Charlotte had an essay. So big up yourself, Charlotte. Well done. So here's a question. How long do implants last? I mean, where'd you start with that? Where'd you start? I mean, how long do implants last? I mean, fair question, no doubt about it. Obviously, people want to know that. But then I'm thinking, God, how do I answer that question? Well, I'll tell you how I answer that question. They built to last forever. So they've got a lifetime warranty. They're supposed to last forever. But things can happen over time. And they may need to be changed. And so I guess the two biggest things are rupture and capsular contracture. So rupture is less of a problem, especially with the modern implants, because they are what's called form stable or cohesive gel, which means if the shell fails, they keep their shape. Capsular contracture is more of an issue, and the quoted figures are normally 15 to 20% at 10 years, which means 1 in 5 women at 10 years will have a hard implant. So 4 in 5 will be fine, but 1 in 5 at 10 years. So I guess that's still not asking you how long they last, because you don't have to have them changed if they've gone hard. You can leave them. You know, it doesn't mean you've got to have, 1 in 5 women have a hard implant. But that doesn't mean they have to have it changed. They might be okay with it, not bothered. So I normally say around 5, because a lot of people say they've got to be changed every 10 years. I don't know where that comes from, and it's not really a thing. I normally say they don't have to be changed at 10 years, but they might start to go hard around 10 years, and you might want to have it changed. That's how I present it to patients. Now, there are different types of implants, the polyurethane foam ones, which are less likely to go hard, but have got other issues of their own. But so they're 1% at 15 years, so they're much less likely to go hard, but so therefore last longer. So is that a question? They might start to go hard around 10 years, and you might want to have it changed, not need to have it changed, and that's quite an expensive operation. So it's something to factor into the situation when you're deciding whether to have implants or not. Hard question to answer. I know I get criticized on YouTube but because they say I'm not answering a question, but it is hard to give a sort of fact, number. Anyway, Elaine, long time no see. Hi JJ, you did my implants up around 6 years ago. I remember you. Over the last few years, my weight has fluctuated and not I think they have sagged. Could I consider an uplift with my existing implants? Yes, of course you can, Elaine. Yes, of course you can. Simple answer, yeah. And if you want me to do it, absolutely fine. If you don't want me to do it, or if you moved away or anything like that, Elaine, let me know and I will give you my operation note, because if the person who's doing it needs to know how I did it first time, if you're having another lift. So it is important to be aware of the pedicle that we used, which is basically how your nipple was left attached. And just so you know, I usually use a superior pedicle for a lift, but I could give you a copy of the op note, or I'll write it in a letter or something if you were having someone else do it. But it's absolutely fine to have another lift if you've already had a lift. And the only thing is just be careful with your weight, because obviously if you have another lift and you have more weight fluctuations, that can stretch the skin again. But yeah, no problem at all. Elaine, call me and we'll book you in. Precious, I heard it last 10 years. Yeah, I heard it as well, Precious. But, I see people who are having 15, 20 years, no problems. I see people having the 5, 6 years, no problems. So it's not a thing. What's happening here? Thanks, JJ. Miss Karina Bean, I think I have a handful of tissue over my implant. I've heard you need 2 centimeters at least for overs. Does it sound like a handful could be 2 centimeters? It's here, Miss Karina Bean. It's here. Here. This is the. It's quite a lot more than 2 centimeters there. This is where your 2 centimeter pinch. So it's not so much your breast, which is here. It's the pinch is here. It's a soft tissue cover here that you're looking for your 2 centimeters. So, but I wouldn't go trying to do that yourself, Miss Karina Bean. That's for the surgeon to do it. But that's where they talk about oh, that hurts now. But yeah, that's where we pinch to see how much soft tissue cover you've got. It's in your chest area here, rather than the actual breast itself. Charlotte, I've been told I can remove the corset bra after 6 to 8 weeks and move to a normal bra. However, I read somewhere that you shouldn't wear a wired bra straight away. How true is this? Does it really matter? Yeah, I mean, this is one of the thing is a very surgeon specific, Charlotte, and I think some people would probably be pretty flexible about it, and some people will be quite strict about it, which probably means there's no right way of doing it. And again, I just go with what your surgeon says. 6 to 8 weeks sounds reasonable, and it's a pretty standard thing. I normally say that the bra can irritate the scar, because there's often a scar down there in the fold. There may not be if you've had a lift with implants, but there might be, and that can irritate the scar. And if it irritates the scar, then don't wear the wired bra. But again, I think the sport bra does matter in the first 6 to 8 weeks. After that, then there is often still swelling, and people often like to wear the support bra, but it becomes less essential. You did a revision on one after the implant dropped slightly 6 months after the operations. Do I remember that, Elaine? Are you one of I always say I haven't had any bottoming out, but then someone, I think it was you, yes. You had a lift with implants, and I think it did bottom out. I think you're the one, Elaine. Yes. Well, I'm glad to hear that it's lasted 6 years. I'll be in touch, but please do, Elaine, and I'll be happy to see you and see what we can do. You still don't do BBL here in the UK, GB. Well, have you done that little GB? I don't, Precious. Whether anyone does, they might be. It's got a bit quiet, the BBL story, maybe because we're not having many meetings and things because of COVID. But I don't, Precious. But there is mixed opinions worldwide, and I know there are people in other parts of the world who say that it's a good thing and it's safe and what have you. And there's so there are mixed opinions, but I don't do it, Precious. Not unfortunately, but it's still a very dangerous procedure. Again, as I say, Precious, there's mixed opinions because there's a lot of there are complications with a lot of surgery, tummy tucks, breast reductions, breast implants, there are complications. And certainly the people who do the Brazilian butt lifts will argue that it's, similar. They even argue that it's safer than things like tummy tuck. Having said that, there's no doubt there are complications with it. But as I say, there are complications with tummy tucks and other things. It's a difficult one, Precious. Certainly the last meeting that we had, which wasn't last year, the year before, was it even longer than that? I can't remember what it was. It was suggested we don't do them, and I haven't heard anything to the contrary. That's in terms of that's the BARPS, which is the British Association of Aesthetic Plastic Surgeons. Whether there are other surgeons who are not in BARPS or are not, whether the guidelines have been really relaxed, I don't know, because it's not really something that I've been following, because it's not really my thing anyway. I never did it even before. I love you because you're very honest after yourself. Thank you, precious. It's very kind. Me too. Try my best. Didn't expect that. Thank you. Right. Yes, I can defo punch there. Don't punch, Karina Bean. Pinch, love. Don't punch yourself. Don't say that I said punch yourself in the chest. Pinch. Yeah, pinch 2 centimeters. It's the pinch test. Right. Oh, look at this. Oh no, it's not. I thought it was something about pressure. I've got something about the bum thing in a minute, but anyway. I want BBA, but did not want GA. What are my options? BBA, GA, TLAs, all over the place. Well, TLAs and BLAs. No. No. GA's the TLA, isn't it? TLA, 3-letter abbreviation, but then I suppose GA is a 2-letter abbreviation, which is still a TLA. Anyway, so BBA, bilateral breast augmentation, and GA, general anesthetic. So yeah, well, you can do it under what's called a Twilight anesthetic, local anesthetic with sedation. Yeah, that's it really. Now, I've got to be honest with you, it's not like local anesthetic. It's not like you're not awake. You're pretty sedated. You're pretty asleep. But it is an option for people who don't want a GA. And so, yeah, that would be an option. But don't expect to be talking during the procedure. You are usually, pretty sedated. But yeah, definitely that would be an option. Hold on a minute. What's going on? Charlotte's back. When can I sleep on my side after breast implants, breast lift? I'm a side sleeper and I'm hating not being able to sleep on my side, but at the same time, I'm too scared to do it in case the implants move. So the problem with that, Charlotte, is again, it depends on your surgeon, because someone's obviously told you not to sleep on your side. So, I mean, basically, I would ask that person, because I don't tell my patients not to sleep on their side at all. I tell them to wear their bra at night or some kind of support. They're taped up for the first week, but it's not even a thing for me. But obviously someone's told you sometime, so you better ask them, because I feel that being able to sleep is really important. So I don't have a thing about the side thing, or sometimes people tell patients to sit up with a lot of pillows. Which again is not really something I tell people personally, but that's the problem with plastic surgery. It's very sort of non-scientific in a way. There's not a sort of set algorithm of this is how the post-op care for a breast augmentation goes. People will use bra straight off the bat. People will use tapes and dressings and support, and the bra for 4 weeks or bra for 6 weeks, and this bra then that bra, and sit with lots of pillows, lots of sleep on your side. Within the surgery, there's lots of things that people do differently. Some people won't use certain medication or will use certain medication and things like that, and techniques. So there's no one way of doing it, but the bottom line is just do what your surgeon says. And I'm sorry that your surgeon's not talking to you, because it's not great, is it? If you've had quite a big op, that is a breast lift with implants. But yeah, the side thing, I don't tell people not to personally, but that's just me. This surgeon is a bloody legend. I'm not sure that was this one or your one, but I want a tummy tuck next year. Maybe I'll stay in the UK and use this guy just for his banter. Is she talking about me? Is she talking to me or about me? Anyway, oh no, no one has told me not to do it. I read it online. Oh, well, there you go. Well, do it then. If no one's told you not to do it, sleep on your side. I'm talking about me. Oh, it's talking about me. Okay. Yeah, just sleep on your side then. Don't listen to what you read online. Just go with what, people tell you. Right. Where am I? Here I am. Can I have Twilight with a tummy tuck? So yeah, so Twilight is the local installation thing. Simple answer is yes, you can. Personally, I feel it's pushing it a bit. I've got to be honest. I don't feel that comfortable with it. I've done. I think I've only done one. I've certainly done. I've done one full tummy. I mean, it was a full tummy tuck with muscle repair and liposuction, so it's a proper tummy tuck. I've certainly done mini tummy tuck with local installation. That's different. Mini lump with Twilight, mini tummy tuck with Twilight's fine, but a full tummy tuck with muscle repair, I have done one, but I feel it's pushing a bit. Now, all the places I work now they can do GA, so I would probably move more towards a GA unless there's a real thing that someone wanted it under local installation. And I would say to them, if we did go down that road, I'd say, look, we'd have a low threshold to change to a GA if you're finding it uncomfortable. Because for me, it's top end of what can be done under local installation, although I know that people do it under local anesthetic installation. So I know it can be done. So the answer is it can be done, but you have to find a surgeon that's comfortable with it. And I'm probably not quite there yet. I'm probably more of a bit more comfortable with GA for that. And it becomes more of a thing, certainly in some of the places I've worked, you can only do local installation. So when you can only do local installation, you might be more inclined to think, oh, this is, either, if you work in a place where you can only do local installation, you either do it under local installation or you don't do tummy tucks. So that's a little bit of a different thing there. All the places I work, we can do GA, so we've got a choice. So I would be, for a tummy tuck, personally, I'd be swaying more towards a GA personally, although I know it can be done and I have actually done it. But that's just where I am. Precious, I meet you in person before. I always say to friends who think of doing breakfast implants. I'm assuming it's breast. That's some kind of bizarre autocorrect. To come to you because you done to my friend and he's the best. That's Precious. I'm going to use that testimonial, if you don't mind, on my website. If you need breakfast implants, come to this guy here because I've done Precious's friends and I'm the best. Breast implants. Yeah, I thought it was breast implants. I've got that correction there, Precious. D. Finally, have a virtual consultation with you after following you for about 4 years. Oh, God, I hope I don't let you down, D. I hope I don't let you down. God help us. The JJ fan club. Thank you, Khan. Thank you. Miss Karina Bean says, thank you so much for your time, JJ. What, are you off now, Karina? Are you off then? Because I've got some more questions here, but yeah. Thank you for your time and thank you for your participation. If you are off, if you're not off, thank you for the thank you. And yeah, we'll I'll get through it. It won't be too much longer. Can I have a time that we've done that one? Do you offer bum procedures? No, I don't. Let's be frank, shall we? We're talking we're talking buttock augmentation, aren't we? So I don't, and people say I should, and I've been to meetings, and they say you should because it's like a breast, but it's on the back, and you've got the same sort of thing, and well, the fat grafting isn't so good. Maybe you should do implants and stuff like that. There's a huge market for it, etc., etc. But the bottom line is no, I don't. I'm probably I've got to be honest with you, at a stage where I probably never will, because just I do what I do. I do what I'm If a surgeon came to the clinic who wanted to work, do that, and work under my auspices, then that I might be open to that. But personally, no, I don't. But I do know that there is a market for it, and I do know that people want it. But at this present time, no, I don't. Is the simple answer. There you go. Are you getting more dates for Droitwich? Not so many, Amy. I thought we were. We've been up and down with Droitwich, and they don't get me wrong. They have been good. They have been really good, and they have been helping me out and give me dates. But I would like more. Should we put it like that? And we were always saying, "You got anything?" I was at Parkway today, which is the one in Solihull, and I said to them, "You're doing less." They're doing less of the NHS stuff, and the problem is they've got these contracts with the NHS, and there's nothing to say they won't renew them, because I think the NHS is still struggling basically with the waiting list, and I think it will be for a long time. So it is a worry, Amee. I've got to be honest, it is a worry how much the private hospitals will be used, and I think there might be ongoing contracts with those private hospitals. So yeah. So we're not getting huge amount of dates at Droitwich. They have been very helpful and they have been helping me out a lot, but I would, could use more dates than they're giving me. But hopefully things will improve. But that's where we are now. Keep on saying hopefully things will improve. Feel bad saying it all the time, but hopefully they will. I have a BMI of 32. Can I have surgery? I've been postponed by a previous surgeon who changed their criteria to BMI of 28. So that's a bummer, isn't it? Changing the criteria. So the BMI of 32. So it doesn't say what operation this is. So I'm assuming it's sort of quite a big operation, like a tummy tuck or a breast reduction or something like that. So there is there is some evidence to say that a BMI of 30, your risk of complications is less if your BMI is less than 30. So the BMI I normally work on is 30. And I say to patients, your BMI, your result is going to be better because you're going to less risk of complications if your BMI is less than 30. That's using the BMI as an absolute number. But it's not written in stone for me. I don't have a sort of strict thing that I don't operate on people who've got BMIs above 30 because it depends on whether what's happening to your BMI, whether the change in your BMI is, which is probably more important. Because if you want to lose weight, if you are unhappy with your weight, much as I'm sure you would love to have whatever it is, tummy tuck or breast reduction or whatever, I'm assuming it's one of these sort of bigger operations. And I understand the argument, say I can exercise better when I've lost weight, etc. If you can lose the weight first, you're going to get a better result. Like earlier, one of my patients who's had a breast lift with implants has had then weight fluctuations and maybe lost some weight, and now the breasts have drooped again. So, you ideally, and I know we don't live in an ideal world, but ideally you want to avoid weight fluctuations afterwards. So if you are unhappy with your weight, much as I'm sure you would love to have surgery now, it is better to lose the weight first. And that is even if your BMI is below 30. So even if your BMI is 28, I would still say to you, look, if you want to lose weight first. Similarly, if you have had a BMI of 45 or 40, and you've dropped that BMI down to 32, massive weight loss, and you're happy and comfortable, you're like, I don't want to lose any more weight, I'm happy where I am, then we could have a conversation about whether you have a surgery at BMI 32. Because, otherwise you might say, look, there's no point in falsely getting my BMI down to 30 or 28, which I'm not happy with, just have the surgery and then I put the weight back on again. That's just not a good thing to do. So it's not an absolute in my practice. I know it is an absolute in some people's practice, particularly in the NHS, and that there's absolutes. Well, the NHS don't do this stuff anymore, really. But I'm sorry if that's been changed by another surgeon, but that's where I am. I do work, broadly speaking, a BMI of 30, but more importantly, so it's not like, I've got my BMI below 30, I can have the surgery now. I'm like, no. Are you happy with your weight? Is your weight stable? I'd like to lose a bit more. Well, lose that first, and then we'll do the surgery when you're happy and stable. You're going to get a better result. You're going to get less risk of complications, and you get a better clinical result. Let's face it, it's a once-in-a-lifetime operation, this. So you want to get it right. So do it at the right time. What's this? Precious JJ, thanks for taking time for answering all the questions. I'm sure if you do bum procedures, you would be the best, just as breast implants. Do you know what, Precious? They say, if you look, you've seen these photos of these buttocks, they sort of look like a breast. So that's what this, I was meeting a few years ago, this guy who was a breast guy who was doing buttocks. He says, looks very similar aesthetic there. But thanks for those kind words, Precious. I'll keep you posted. Hannah Resoda Hi JJ, seeing you next week anyway, but hubby wants to know if you have any kind of software which can give you a virtual idea of what you look like after surgery. Thanks. I don't, Hannah, but it does exist. I'm assuming we're talking about breast implants, although actually the software works for lots of other things. And one of the problems, a bit like I was saying earlier about the post-op regimes, are all different. How people counsel people for surgery is different in terms of body reshaping surgery, whatever it may be. And anytime there's lots of different ways of doing something means there's no one good way of doing something. If there's one good way of doing it, we'd all just do it that way. Probably the big one is breast implants. I don't know if it is breast implants, but let's just use that as an example. And there is software where you can take a photo and you can morph that photo, and they can even put in the implants, say, look, that's the 250cc implant, that's what it looks like, and what have you. And there's software where it morphs it on the screen. There's software where you put glasses on and you look down as if you've got those implants in, type thing. And I have looked into it, Hannah. I have looked into it, and the problem with it is two things. First of all, you never know really what you're going to look like. It helps. I think it does help, but you never really know what you're going to look like. And for me, I think the way I choose implants is I base it on dimensions. I base it on the width of your chest. I base it on the profile of the implant. The actual volume of the implant comes last because the shape's really important. And that's how I do it. I do it with a width of breast, number one, shape and profile implant, number two, and then size, number three. And it's in that order. And I don't really want, I think that when you get into things like these softwares and what have you, people can, especially when they can do it at home, when people can do things at home, like the rice test. I don't talk to people about doing the rice test at all, where they can fixate on volume, they can fixate on size. And I think it's really important to look at the shape. Now, you could argue that the photos will give you the shape, will give you an idea of shape, but it's like anything. It's not, I don't want you to say, oh, look, there's the photo I want. That's how, I can't guarantee you're going to look like how that looks. So I don't use it, Hannah. It'd be really interesting to hear from people who've seen people who do use it versus people who don't use it, to see what they think of it. But from a surgical point of view, and certainly speaking to surgeons who do use it, I think the main benefit of it at the moment is patients like it because it sounds good, that it's almost like a marketing thing at the moment rather than a real thing to help choose an implant. Because I choose an implant based on width, on the dimensions of your chest. The software is not going to help me, but it might help you, but it might not, because it might give you an unrealistic expectation. So yeah, I don't, Hannah, but I'm not. The buttock implants, I'm pretty sure I'm not going to do those. Whether I'm going to use the software, I'm not. I wouldn't write it off. I might come on one day saying, "Hey, good news! We've got this fantastic software. It's brilliant. It's the way to do it." But at the moment, I don't think it is the way to do it. I think it is a useful tool. But the other thing, Anna, is it takes so long to do a breast implant consultation. If you start getting into this, that's going to elongate the consultation even more. But that's not the main reason, to be honest with you. I don't mind that so much. Yeah. I'm open to suggestions on that one, Hannah, but at the moment I'm not into it as it stands. But I look forward to seeing you next week, and I'll see what you think about it. See what you think about the way I do it anyway. Precious, with vascular problems, is it safe to do a breast implants, JJ, or any other surgery, JJ? What sort of vascular problems, Precious? That's the question on that one. What are we talking here? What are we talking? Oh God, has people said stuff on Instagram? Have I? Oh, no, sorry. It depends, Precious, on what vascular problems you're talking about. So basically, in general terms, if someone's got problems with another system, or with vascular problems or kidney or liver or something like that, we would normally talk to the doctor who's looking after your problems. So the doctor who's looking after your vascular problems and say, we think you're doing breast implants, is that okay? There's no specific problem with vascular problems and breast implants, if that's what you're asking. No, I don't think there's any specific link. But just in general terms, if people have got other medical illnesses, we would have to put that into the balance when we're deciding whether we do surgery or not. Amy, I have to wait patiently for my belt lipectomy. Big op, Amy. That is a big op. Oh, you're asking about droitwich? Yeah. 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 Yeah, Amy. Keep your chin up. Hannah, TT and BBA. Yeah, TT not quite so. So Hannah's talking about the software. TTA not quite. Sorry, tummy tuck not quite so much, but definitely BBA. it is a thing for BBA. I think the way that the software is really used is rhinoplasty, which I don't do, but I think rhinoplasty is another one. But again, I've seen arguments both ways. You know, a lot of surgeons worry about people, you know, sculpting, for instance, a nose or a breast on a software to how the patient wants it to look, and then not delivering that. You know, it's like, But I think, you know, I'm not sure how strong an argument that is, because I think you've got to, anything you do is an approximation. You've got to stress is an approximation of what could be achieved. But as I say, I personally don't see the need to it, but I do think patients would like it. And I think if I did get it, then I think patients would like it. The other thing, Hannah, just to get behind the scenes on it, there's different types of software you can get for this morphing software, and the one that I liked, I think it's about £40,000. I think there is one which is about £1,000 or something that clips onto an iPad and things, and it's quite easy. But the there's much more expensive ones, and a friend of mine's got one which is £250,000, £250,000. It's a thing that does a 3D image of your whole body. Only one in the country, I think, in South Wales. So, yeah, Anthony McQuillan's his name. So if you want a 3D picture of your body, good for mole mapping and stuff. Anyway, so yeah, that's where I am on that one, Hannah. Right, what we've got, talk me through tummy tuck and how long can you stay in? Right, Salma, hospital. How long can you stay in hospital, or how long do you need to stay in hospital? So usually it's a one night tummy tuck. It's I use drains for tummy tuck. So the drains come out the next day usually, and then if you feel up to it and you're up and about, then you go home the next day. Sometimes 2 nights if you're not feeling up to it, the drains take longer or whatever. But one night is sort of normal for a tummy tuck. But it's, you know, 2 nights or even 3 nights is not unheard of. But yeah. Is that enough of talking through? I don't feel like I've talked you through a tummy tuck there, but anyway. Come back at me, Salma. Come back at me if you want me to talk more. Where are we at? Do we do ear folds? No, we don't. We used to. We had a guy called Mark Lloyd who did ear fold. So ear fold is a little metal clip that goes on your ear for prominent ears. And there's a way of treating prominent ears, which we do. Not so much me, but the other guys in the clinic do. So we do treat prominent ears using the traditional method, which is scoring the cartilage. But there's a relatively recent invention invented by a plastic surgeon, actually, which is a little metal clip that you put underneath the skin, just on the fold of the ear to create the ear, to create that fold, the antilical fold, which is that fold of the ear there, where people with a prominent ear don't have it. And I was very excited about it, and I did a web page on it and things like that. Now the web page isn't actually accessible from my website, but I think if you Google it, it does come up. So we do get quite a lot of people asking about it, but which is a bit awkward because we don't do it anymore, because there's only a certain number of people who do it in the country, and Mark Lloyd was one of them, because he was he specialised in ear reconstruction in the children's hospital. But then he wanted to make his focus his work down in London, so he no longer works in the clinic. So we don't do it anymore, unfortunately. So no, we don't do ear folds, but we do prominent ears with an anterior scoring, which is a more comprehensive way of sculpting the ear. So ear fold is only really for a select group of patients who have a problem with that specific area. If you want, you can use the sculpting technique for any prominent ear. But nevertheless, I think it did seem to be a good option, and we were quite excited about it when we started. But then Mark left, so we don't do ear fold anymore. So hey ho. Hi Jess, nice to see you. Good to see you're upbeat tonight. Come on, what time is it? 8 o'clock. It's quite late, isn't it? Quite late. I'm still going. I've got a few questions here, but please ask if you've got anything. But the question I got here, actually only got 2 left, so get them in. Get them in. What happens here on Instagram? What's this? Oh, that's the sunglasses and stuff. Can I do the stickers? Oh God, camera roll. I wonder if I could do that sticker that says "Ask a question." No, okay, never mind. What's that? Better not mess too much. Oh, God. Oh, I think I turned my camera off. Okay, right, I'll stop pressing those buttons. Guide, I missed the start. Jess, you haven't missed anything. You haven't missed anything. You can replay it, can't you? IGTV, I think you can somehow replay it. Don't worry. We'll be back next week. Anyway, I'm still going. I'm still going. Laura's only just joined. You're not as late as Laura. Is there a charge for different silicone implants? Silicone spelled wrong. Never mind. Another surgeon I seen quoted me. Silicone spelled wrong both times. Anyway, rise above it. Another surgeon I seen quoted me different prices for silicone implants. So just for the viewers on Facebook and Instagram, not on Instagram, on YouTube, do the little things come up on YouTube? If this does come up on YouTube, silicone's only got one L. So anyway. So we don't charge a different amount for silicone implants. We got two prices for implants, one for polyurethane, one for silicone. Having said that, I think there is a different price for implants. So teardrop implants, for instance, are more expensive than round implants, but we don't charge differently for teardrop and round. We used to, because the hospitals used to, but they don't anymore. So we don't. So yeah, it used to be that teardrop implants were more expensive. Well, I think they are still more expensive, but I guess we just absorb the cost now, and we don't pass it on because I think it's too confusing. You have a teardrop and you have a round, and you have a polyurethane and a silicone, and it just gets too confusing. So there's only two prices: polyurethane and silicone. So all the different types of silicone implants. So there's smooth, there's micro textured, and there's macro textured, and there's teardrop and round. They're all the same price, although the teardrop and round only come in the macro textured. You can't get teardrop implants in the smooth, and the micro textured because they don't adhere and they would flip around. But yeah, so in my practice there is no different price for the different types of silicone implants, although if another surgeon is quoting different prices, I can understand why, because the manufacturers do charge a different amount. They charge a bit more for teardrop implants, and there's more risk of complications with teardrop implants, so you could argue that there is a reason to charge more because you might need revision. So there might be a justification there to charge more for teardrop. I think there could be a justification to charge more for teardrop, but we don't. Salma, basically, I really want to get a tummy tuck, but I'm terrified. Salma, were you the one who was asking about the GA thing? Are you terrified about the GA and having done a local installation, or are you just terrified about the whole thing? Well, either way, it's a big op, Salma. Tummy tuck's a big op, and I think everybody having one is going to be concerned, but it's the only way you can tighten that skin. That's the problem. So yeah, whole thing, yeah. It depends on how much of a problem it is for you, Salma. That's the answer. If it's a big problem for you, if that loose skin is a big problem, you don't like it, then the benefits will outweigh the downsides. But if it's not a big problem for you and you're really worried about it, and you're terrified and the whole thing, oh, crikey, I'll be like, well, don't have it. Carry on. No risk of complications, cheap, free. So that's the way to think of it. There's always an option not to have it. But then when you say don't have it, then people say, yeah, but I hate this and I can't live like it. Well, have it then. Oh, yeah, but I'm worried about it. So it's about balancing it, basically. I don't think that's been very helpful, has it? Might have to work on that. Anyway, yeah. It's a big op. It's a big op, Salma, and you have to go in informed and make a balanced decision. But I think you'll find that anyone having a tummy tuck will accept it as a big op. And if you sorry if I don't, if you are my patient, Salma, we can put you in touch with someone who's had it done. That can sometimes be helpful to, that might help. Jess, looking forward to meeting you tomorrow. I am looking forward to meeting you tomorrow, Jess, very much so. So, yeah, that's going to be a good day tomorrow. Here we go. Last question here in my repertoire. Do we treat cysts located on the finger connected to ligaments? I know what you're talking about there. What you're talking about there is ganglion. And yeah, correct to think that plastic surgeons treat that, because they do. We do hand surgery, and there are some plastic surgeons who specialize in hands. There's a few subspecialties within plastic surgery, of which hands is quite a big subspecialty. And so plastic surgeons do treat ganglions, which are cysts on the joints, which can be in the fingers and also in the wrist. But we don't do it at the clinic. None of us at the clinic are hand specialists. So we do not treat ganglions or these cysts. We treat cysts, so cysts of the face and on the body, but we don't treat cysts on, it says here connected to the ligaments. They're not connected to the ligaments, they're connected to the joints. So you get them at the distal phalangeal joints, you get them at the wrist, you can get them here on the wrist. So yeah, that is a specific thing that plastic surgeons would treat, but you need particular equipment to do it. You need a tourniquet and things like that, which we don't have at the clinic, because we don't really do a huge amount of hand surgery / any hand surgery really. We just do moles and cysts. If you had a mole on your hand or a tattoo on your hand, we might do it, but we don't do, like, you know, that sort of hand surgery. So no, we don't. Sorry about that. But yeah, look for a plastic surgeon who specialises in hands. Off the top of my head, I'm going to say Darren Chester works in Droitwich, so he might be able to help. Lovely guy. He specialises in hands. And there will be loads of plastic surgeons who specialise in hands, and I apologise for everyone else that I've forgotten. But yeah, Darren's a good guy. Right. Chimini Winter, hey, how are you? I'm booked in for reduction in October. A thought popped into my head today. How long after surgery would I need to wait before I can drive again? Well, a reduction is a big op, my friend. I think you know that. So I normally say 2 to 3 weeks. It varies from person to person. Some people recover really quickly. Some people would take longer, particularly for reduction down that T-junction. You can have a wound, problems can feel a bit tight. Obviously, you have to wear a seatbelt. You have to wear a seatbelt on the way home from the operation. So you obviously have to wear a seatbelt straight off the bat. But at 2 weeks, you might be okay to do little bits and bobs. 3 weeks is safer. After the first week, you'll come back, have all the tapes removed. They'll be a bit swollen, be a bit tight. And I don't think you're going to feel like it after the first week. I've got to be honest with you. But I think 2 weeks is often okay. Sometimes you've got to check with your insurance company, because they might say a certain amount of time after surgery, car insurance, that is, or they might say it's up to the doctor. But if it's up to the doctor, then, yeah, 2 weeks is normal. You'll see Vicky at 1 week, and then we'll see how you're healing. And as I say, 2 weeks is normal, as long as it's sort of short trips and build it up. I thought that might be the case. Not a problem. I'll just have to get the hubby to tell me about. Absolutely. Doctor's orders. Doctor's orders. Didn't think about that. Yeah, doctor's orders, and just take it easy for the first couple of weeks, and then slowly get back into it is what I would say. But we'll be with you, and you can always drop us an email, give us a ring at the 2 week mark if you're not sure or what have you. So yeah, but looking forward to it. When is it? October. Looking forward to it. Not long now. What's happened there? Makes perfect sense. Do you do tummy tucks under LA? Nicole, where were you earlier, girl? Come on, girl. Where were you? We've done this one. How would I answer that? It can be done under LA, Nicole. Well, let's be clear here. Not under LA. LA is local anesthetic. It's local anesthetic with sedation. And you're pretty heavily sedated, so you are not awake. You're pretty heavily sedated. Now, all the hospitals I work in have the facility to do GA. And I've got to be honest with you, I feel more comfortable doing a tummy tuck under GA. I do. I have done them under LA. I say I've done them under LA. I think I've done one full tummy tuck. I think I've only done one full tummy tuck with lipo, with muscle repair. You know, a mini tummy tuck's a different kettle of fish. But a full tummy tuck is quite a big deal to do under a local with sedation. And when you are under sedation, you're quite heavily sedated. So I got to be honest, I would probably veer more towards GA for a full tummy tuck. But having said that, it can be done under local sedation, and there are a lot of people who are doing it and getting good results and doing it safely, etc. So it is not, outside the realms. But for me personally, it's top end of what can be done under local sedation, and I'll probably be veering more towards GA, although I have done it under local sedation and it was fine. But it is quite a big deal for that. But certainly something we could discuss. Laura Jones, I think I should know this, but just went to double check, please. What's the recovery time for breast augmentation? Depends what you're doing, Laura Jones. So I normally say the first week you don't feel like much. With the driving thing, you might be okay after the first week. Again, you have to wear a seatbelt, etc., and you've got a supportive bra on. But driving, you might be okay after the first week. 2 weeks will probably be safer, but you might be all right after the first week to do, again, short trips. Second week, you'll be doing better, doing email, stuff like that. If you're doing the gym, I normally say lower body after 2 weeks, which means the exercise bike and the cross trainer and things like that. And then nothing too much with your upper body for about 4 to 6 weeks. So at least a month before you're doing anything with your upper body. Bra day and night for a month. And then especially if your job does heavy lifting and stuff, not for a month. So if your job does heavy lifting, what we can often say is like usually it's like 2 weeks off, and then followed by 2 weeks light duties or phase return to just sort of bring you into it. And then after 4 to 6 weeks, you can start getting into the heavy stuff. And it has a few months for everything to settle in terms of the shape and what the swelling and what have you. It does take a few months, almost like 3 months before that really starts to settle. So it does take a long time for everything to settle after a breast augmentation. How's that? Thank you. Thank you for asking the question, Laura. So I don't know about you, but I'm going to be here next week, 7 o'clock, to answer more questions. Please keep bringing the questions on because I'm loving it. You're keeping it going. It really does help when you participate and ask questions. So thank you to everyone who's asked questions, both prior to this and also during this. If you have any questions, feel free to message me. I will message you back with the answer, but I will also talk about it here if you want. And I'll be waiting, and I will see you next week at 7 o'clock. Have a lovely evening. Let's go watch those Olympics because we're doing well, aren't we? And I will look forward to seeing you then, 7 p.m. right here. Have a lovely evening. Night.